Questions from the committee? Are any? Yes, Dr. Lau.
There appears to be some overlaps between the DGA and at least the example you used, the nutrition and obesity. Can there be some way of collaborating within the two agencies? And if so, how? And this exchange of the evidence base, the systematic reviews.
All right, first thing I need to do is make sure this is, there we go. It shows red and mute, but it is on. Yeah, there's a number of different ways that collaboration could be possible. The dietary guidelines in the past and also the physical activity guidelines, both of which are, there are people at CDC who are involved in. We have looked at whether we could do even simple things like sharing searches because there's huge amounts of work that need to be done even on just pulling together a search. And we've talked a little bit about the fact that there are many new systematic reviews in the field, and so can we take an existing systematic review? Another thing that we do with some review groups is to identify whether a review could be done by us that would also serve the purposes of someone else, or vice versa. So for example, we've partnered with Cochrane when they're doing a review and brought it to our task force at the same time because they're interested in the same questions. We have also entered into discussions with the task force in Canada to see if they might be interested in doing reviews. So there are mechanisms to do everything from a full review where you might be interested in a review that the task force looks at, right down to just helping out with certain tasks. I will also note that many of you might be familiar with the National Prevention Strategy. And the National Prevention Strategy is required to pull together evidence. And so rather than duplicate, it uses the community guide reviews in areas where they're available. So again, that's another potential model. We are mandated by Congress to bring our reviews to the task force, and the task force is mandated to make recommendations for U.S. decision makers. So the mandate, the task force must continue to do that, and that's an independent process. But this committee might be interested in the review itself or the way the task force looked at the evidence as well.
Yes.
No one else. I'm also curious as how are the topics identified by the task force. I mean, for the DGA, I guess the overarching interest is to promote health and well-being of the population, whereas it appears that task force is more narrowly focused on specific public health problems like obesity or certain kinds of behavior, which in some sense is kind of more narrow. So we just want to see what is the process in it.
I think, Dr. Lau, you were the very first person who's thought that our scope was narrow. As an example, our sister task force, the U.S. Preventive Services Task Force, has an active list of topics of approximately 300, and we've estimated ours at over 800. So we actually are responsible for the full gamut of public health, and so when I showed you topics, these are the ones we've actually managed to do to date, and we are up about 225. And so the list that I showed you of prioritization criteria, those are things that the task force considers in looking at each potential area that we could move into. Two other things that are important are that in public health, because of the wide range of settings and situations and amount of money, typically, rather than doing one-off interventions, we attempt to look at a number of potentially effective interventions within an area so that people have a menu of options from which they might look and choose one that might fit their needs. And so we, right now, use the Healthy People 2020 areas as the broad topics. And there is a broad solicitation of public input into who thinks which areas are important. All of that information is pulled together. We then, the criteria that I showed, the staff pull together information on each of those factors, put them in front of the task force, and the task force in a public meeting deliberates on them and comes up with the overall topics. So then, which ones we move into, we try to find groups that we can partner with, and then we move in that direction.
Yes, yeah, Morton, Dr. Morton.
Hi, Sally Morton. Thank you for that presentation. In trying to compare and contrast what you do with the NEL and the DGA, I'm feeling like with your process, more of the synthesis occurs at the CDC, whether that's, I love the charts, and even though you couldn't reach a meta-analysis, but the figures and the symbols. And so can you compare and contrast how much of the synthesis occurs with you and then is presented to the task force versus maybe with the NEL, more of the synthesis occurs with the DGA committee itself? Am I interpreting that correctly?
Yes. The synthesis actually is done, and I want to be careful, it's not just the CDC. I want to reiterate again the importance of our coordination teams. As an example, when we did worksite health reviews, we had a VP from Coca-Cola and union members sitting on the team. When we did reviews looking at the effectiveness of abstinence education and comprehensive risk reduction in reducing risky sexual behavior, we had proponents of both sides sitting in the room, and they were some of the most interesting and challenging team meetings we have ever had. And so the intent really is to have people involved in getting the information to bring to the task force that will inform them. But you are correct, it is that broad team of people who are involved, who pull the information together, who do the syntheses and bring them to the task force. Now, the task force can ask all kinds of questions, and even though we bend ourselves into pretzels to anticipate everything they might ask, they often have questions and might send us back to do more analyses. So we do the syntheses, but they are the ones who determine if it is sufficient for their purposes.
Yes, Dr. Roberts, last question.
Is there a formal way by which the information that you collect gets into the Dietary Guidelines Committee? Because it seems extremely relevant, but I wasn't aware of any kind of formal connection.
At this point, there's not a formal connection. We have recently merged our obesity and nutrition reviews because there's so much overlap between them. And so we actually have an active review team. We are moving forward. We have limited resources, so we're moving forward slowly. But there is no formal connection right now. You may very well be interested in some of the reviews we're doing and the ability of doing reviews in some way that are supportive of both is something worth considering.
Thank you very much, Dr. Mercer. Quick answer, if you can do it in a few seconds.
Sorry. My comments is that I recognize that there is a lot of questions. So my previous comment was not that, nothing to do. Given the large number of topics, is there the approach you mentioned to prioritize the topic kind of intuitive and based on expert opinions? Is there, you perhaps thought about a more explicit model of prioritizing them based on quantifiable thing like DALI, quality, and
we do that. I'm not sure if you can go back to my slides, Meredith, or whether they're entirely gone. If you could go to the presentation and go right to the end and just go forward a couple, DALIs and all, exactly. We look at burden, we look at preventability, and these are all, the burden is done using QALYs, and DALIs are appropriate. So I'm not sure if that can, if you go, yes, that's it. So the assessment there, as you can see, we do quantitative measures where they're possible and qualitative as well. So it's a combination of both.
Have you met with any resistance in use of those metrics?
We have met with people who are very interested in these measures and would like to use them themselves. So no, we've not had any resistance yet.
Thank you.